Welcome, everyone. Welcome, everyone. Thanks for joining us today. My name is Caitlin Graves. I'm a social worker at Northwest Medical Specialties and also a member of Cancer Support Community. And we are happy to have Dr. Schuster here with us again today, talking about naturopathic medicine for cancer care and prevention. So I think a lot of you here know what Cancer Support Community is, but just to refresh you, our affiliation with Cancer Support Community and Northwest Medical Specialties, we're able to bring different programming to you guys just like this, educational workshops, social events, support groups, and other, healthy lifestyle and other support resources. So we're happy to have you here, and just want to talk about, a little housekeeping and today. So, go ahead, and we have a pretty small group, so I don't think Dr. Schuster minds if you have questions throughout. So you can always unmute yourself if you want, or you can type your question in the chat box, and we can get to that as well. Otherwise, we'll take questions at the end, kind of like always. And then for best viewing option, definitely want to have speaker view, which you can change at the top right corner of your screen. So with that, I'm going to hand it over to Abra, and she's going to introduce Dr. Schuster.
Thanks, Caitlin. So it's my pleasure to introduce Dr. Schuster. Dr. Morgan Schuster is a licensed naturopathic physician who received her doctorate in naturopathic medicine from Bastyr University in Seattle, Washington. Dr. Schuster has extensive experience working in an integrated oncology setting, including Swedish Cancer Institute and Northwest Medical Specialties. In addition to working with patients diagnosed with cancer, she has a focus on helping patients who have been diagnosed with complex chronic health conditions, autoimmune diseases, women's health issues, and fertility concerns. She received an honors in counseling from Bastyr University, as well as graduated from the New England School of Homeopathy. Dr. Schuster's approach to medicine is to assess each patient as an individual, keeping their whole health in mind, including their mental, emotional, spiritual, and physical well-being. Her emphasis is preventative medicine with a strong foundation in nutrition and lifestyle modifications. She utilizes a combination of conventional therapies as well as botanical medicine, nutraceuticals, vitamins and minerals, pharmaceuticals, homeopathy, and hydrotherapy, which is water therapy. Dr. Schuster believes that each person's unique story needs to be heard in order to get to the root cause of their ailments. So we're very happy to have you here, Dr. Schuster.
Well, great. Thank you, guys. Thank you so much. I'm happy to be here as well. And so today we're going to be talking about kind of what is naturopathic medicine, how may it help you during your treatment or, as part of a prevention or survivorship plan, and kind of what are my principles as it relates to naturopathic medicines, what do I think is imperative, and how can we support the body? You will get a lot of tips and tricks and different things to think about encouraging and incorporating today. Of course, I say this with pretty much all of my talks. If you are thinking about adding in a new supplement or a vitamin or an herb or making a big drastic change in potentially your lifestyle or your nutrition, definitely talk with a knowledgeable healthcare provider, whether that's a naturopathic physician or a medical doctor or someone in your care team. And there can definitely be interactions. I don't go into a lot of supplement things today, but if you do have some questions or something comes up, you can, of course, put it in the chat box. Again, I try not to make too many recommendations in regards to supplements or nutraceuticals, just because I don't know everyone's health picture. I don't know your health history. I don't know what medications you may be on. And so there absolutely, especially when it comes to natural medicine, there can be interactions. And so that's very, very important, once again, to speak with a knowledgeable healthcare provider. So that's my little caveat, my kind of warning initially, but let's just dive on in and see what we're going to talk about today. So the first thing we're going to talk about is what is a naturopathic doctor's role in your cancer care, whether that's during treatment or, part of your prevention plan or your survivalship plan. What do I think are my 6 principles for health and disease prevention? We'll go into that. And this is based on what I feel like are the foundations of health, especially in regards to disease prevention. And then, like I said, we'll go into some tips and tricks, things that you can start doing today that will affect how you feel tomorrow. So a lot of take-home ideas. And this talk is really about providing you with what is the most up-to-date, somewhat accurate information, hopefully, so that you can make the best decisions for your health and wellness. Like I said, keeping in mind, there can be interactions. So my goal is to help you be healthy, stay healthy, and have fun with what you're doing and feel good along the way. So hopefully that all sounds good to you guys. And again, if there's questions throughout, just, either unmute yourself or put the message in the chat box. All right. So what is naturopathic medicine and what am I going to be talking about today? So as one oncologist stated that, chemotherapy, radiation, surgery, et cetera, all the treatment during cancer care tends to break down the body, but Dr. Schuster will help build it back up. I actually think that I said anonymous oncologist because I didn't ask her permission, but I think it might have been Dr. Blau that said this, and one of my patients told me. And that's exactly how I see my role. I feel that my role is to help build back your body, to keep you strong and healthy today, tomorrow, and years to come. And what are ways to do that? Well, we'll go into that, what I feel like are the principles there. So these are kind of the foundations, just a brief overview of what I see are the foundations of health. And kind of the foundation, one of the main foundations is kind of mental, emotional, spiritual well-being, however one perceives that. And there's lots of ways to approach that. We'll go into that a little bit today, but I actually do feel that that is one of the biggest foundations, is kind of what's going on here, what's going on up here. And then in regards to that is how do we then manage stress, whether that's stress from the environment, physical stress on the body, emotional stress, stress from an illness or an injury can be a stress, and how do we then manage that? And then I think the other 2 things that are super, super, super important and just part of the foundations of health are exercise, getting in movement, and keeping the body moving. So really, to prevent things from happening down the road, we got to keep the body moving. Once the body stops moving, then things start to kind of slow down and pain can start happening. All of these things can start happening. So keeping the body moving is so important. And there's lots of ways to do that. It doesn't just have to be exercise, but movement is really important. And nutrition, I have a strong foundation. I feel that nutrition is super vital, super important to one's health and well-being. And it's one thing that we can control. We can't control everything that happens in life, but what we put in our mouth, what we decide to eat, is one thing that we can control usually, hopefully. Again, I'm not a nutritionist, I'm a naturopathic doctor. So, my training is I have a lot of training in nutrition, but I'm not a nutritionist. And sometimes there's some different approaches with nutrition. So what my emphasis is in regards to nutrition is more in terms of encouraging nutrition, encouraging certain foods and certain food groups. And we'll talk about that today, versus so much, I don't make a big deal. I don't emphasize a lot of things to think about avoiding. I do bring some stuff up, but most of my nutrition approach is how do we encourage, kind of a healthy, sustainable nutrition. And we'll go into that shortly. All right, so what is a naturopathic doctor's approach, or what can we offer in an oncology setting, or sometimes we like to call it, adjunctive naturopathic management or care. So naturopathic doctors offer supportive care in an oncology setting, or like we said, sometimes we use this term naturopathic adjunctive management. Meaning we provide safe, effective, evidence-based treatments to help manage symptoms and side effects, as well as pre-existing conditions in order to improve one's quality of life, and also, more importantly, your treatment outcomes. So we know kind of what are some ways to support the body to minimize side effects if side effects do occur, or to help manage other chronic health conditions. Also, just how to kind of support the body during treatment and then beyond. I feel that my goal is to help keep you, the individual, as strong, healthy, and comfortable as possible, both before, during, and after treatment. So again, if there's certain pre-existing conditions that may affect how well one tolerates treatment, responds to treatment, or influences treatment in some way, possibly post-treatment success, that's what we're going to focus on, we'll work on. And then any other side effects that may have come up, whether that's, side effects during treatment or after treatment. And then the other thing that we pay close attention to is really avoiding any unwanted interactions with treatment and other medications. And that's, I think that's the difference between looking, on Dr. Google versus, speaking with someone who's very knowledgeable and has a lot of training. Our training is to be sure that we're avoiding interactions with treatment, and you can't necessarily get that from Dr. Google all the time. So we spend quite a bit of time and attention in avoiding any unwanted interactions. And this may mean, you're on things like tamoxifen, and there are herbs and nutrients that if you look up, hot flashes, how to manage hot flashes, there's going to be a whole list of wonderful herbs, but some of those herbs you got to avoid during treatment. So that's what we're really, really, really knowledgeable in. And then of course, I love, and where I really feel like we shine is with prevention strategies. And again, and here we provide safe, evidence-based strategies that really all patients want to know about. And some of those things we'll talk about today to prevent disease and minimize recurrence. And I go into this with my 6 principles. And my goal, as I see it, is to encourage my patients to implement good health habits towards disease prevention. So let's talk about what those 6 strategies are. So first, like I mentioned, is finding a sustainable nutrition plan. So some way of encouraging nutrition that you will be able to implement for the foreseeable future. And we'll spend quite a bit of time of that today. I've talked about it before in other presentations. Generally, my tendency is to lean towards more of a whole foods diet or an anti-inflammatory or Mediterranean diet, and even potentially ketogenic diet in certain situations. But whatever you're choosing, you're needing to find one that you can conceivably do for the rest of your life. I'm not into the yo-yo dieting. I'm not into you finding, doing a diet for a week or a month. I want you to encourage nutrition that's going to be sustainable for the foreseeable future. And there's certain principles and nutrients that you'd want to encourage, and we'll talk about those today a little bit. And specifically, the way that I'm approaching nutrition, especially in this type of setting, is thinking about nutrients that are going to support the body and provide all the micronutrients, macronutrients that one needs in order to prevent health conditions, disease down the road. And then exercise, implementing a good exercise routine, what that might look like. We'll talk about that today. Sleep and stress management. I cannot tell you how important sleep and stress management is to one's health and well-being. And there's definitely, there's ways, if you're not sleeping well tonight, there maybe are some tips and tricks that we'll hopefully go over today that will help you to sleep a little bit better, because that is so important for the immune system. If there's one thing that you're going to do to help boost your immune system, I would say sleep. Get in more sleep. Sleep is so, so, so important. I'll talk a bit about intermittent fasting, because I actually do feel like that has a role in cancer care and prevention, and also disease prevention, and why it's a very popular thing right now. And what does intermittent or time restricted feeding even mean? Why even do it? Why do we care about it? We'll talk about that. And then detoxification, how to support and promote detoxification safely, gently, and naturally. And that's a big foundation in naturopathic medicine and kind of my principles for health. And then the gut. And I'll specifically mention and talk a little bit about the gut microbiome, but I feel that the gut is one of the best, is our foundation for a lot of our health. I think Ebra mentioned I have a background also in Ayurvedic medicine, which also has a very strong foundation in how is our gut doing, how can we support our gut health, because the gut plays a big role in how we feel overall, how do we, disease prevention, also mentally, emotionally, what's going on. The gut plays a big role. So we'll talk about the gut microbiome and how to support that organ system, and in terms of how do we prevent disease down the road and also keep one strong and healthy during treatment. So those are the principles. All right, so number one, finding a sustainable nutrition plan. So I get this question all the time. What should I eat? What food should I encourage? What should I avoid? And there's a lot of good, nutrient models out there. And so these are the most common ones that I see, Mediterranean diet, anti-inflammatory diet. These are my abbreviations for those. You'll see them throughout. Vegetarian or vegan diet, how to do that, maybe how to make that sustainable for one's lifestyle. Ketogenic diet, what's up with that? We'll go into the research there briefly. And then lastly, I tagged on, it's not really diet, but alcohol. What is the role of alcohol? And can I drink alcohol or should I not drink alcohol? We'll talk a little bit about that. All right. So with that in mind, first and foremost, I think the main key principles with finding a sustainable nutrition plan is thinking about encouraging whole foods and why. So no matter what diet you choose out there, really thinking about whole foods is going to be really important. So when we're talking about whole foods, we're talking generally about fruits and vegetables, whole grains, healthy fats, proteins, what you can look at that food item and where it came from. And we're avoiding, ideally, really processed foods. Anything that's maybe from a box or a bag where you're like, I'm not really sure what this ingredient is. It's a really long word. Is that even a food? We're trying to avoid those ingredients, those foods, as much as possible. Often anything that is ultra processed, anything that you find maybe in a box or a bag, they are often stripped of essential fatty acids or essential components. Omega-3 is being them in order to preserve the shelf life. And we need omega-3s. Omega-3s are anti-inflammatory. They are healthy fats, but they are stripped. They get removed in processed foods to help preserve the shelf life. The ultra processed foods also generally have higher levels of fats, saturated fats, usually added sugar and salt, and are therefore also generally lower in fiber, vitamins, and nutrients. So we want to avoid that. These items often contains a lot of additives, and many of those additives, those long words I was talking about, have carcinogenic properties. So anything that has, I can't even pronounce a lot of these words, but I've definitely seen them on some processed foods. But these are all carcinogens. So these would be foods that we'd want to avoid. And they also, many ultra processed items contain materials like BPA or bisphenol A, which is also another carcinogen and also a estrogen mimicking molecule. So when the body sees this molecule from a food item, it thinks it's estrogen and it will store it in fat as estrogen. So we want to avoid as much as we can those foods for a number of different reasons. So that's why we want to generally, whatever diet nutrition plan we are thinking about encouraging, we want to encourage those foods that are whole foods, the fruits, vegetables, whole grains, healthy fats, and protein. All right, so why fruits and vegetables? Why do we even care about fruits and vegetables? Well, for a number of different reasons. The fruits and vegetables contain phytonutrients. And so phytonutrients are often what provide the colors to different fruits and vegetables. They can make vegetables help to make them look red or yellow or purple or white. Those are phytonutrients. And phytonutrients actually serve lots of different properties. They help to stimulate the immune system. They reduce inflammation that therefore can make cancer cells grow. They prevent DNA damage and they promote cellular repair. So these phytonutrients actually do protect the vegetables and fruits. And then when one consumes it, it does the same thing in the body. So it helps to prevent DNA damage, which is incredible. It's actually really mind-blowing to me. And they generally help to regulate hormones. So I often tell people, if you read the label on a fruit or vegetable and it said it could do all those things, I mean, why wouldn't you eat that? Or why wouldn't you consume those things? So we want to encourage the rainbow. We want to encourage all those different colors. What the American Cancer Society recommends is between, I think it's even more than 7 servings per day, but it's between 5 and 7 servings of fruits and vegetables per day to just help prevent disease and prevent cancers. And every fruit or vegetable looks a little bit different in terms of the serving size. So for instance, one kind of medium large size apple is about 2 servings of a fruit. So if you're trying to think about getting 5 to 7 servings of fruits and vegetables in per day, that's going to vary based off of the fruit or vegetable. And the trick that I tell a lot of people to do is just whenever you're eating a meal, try to have half of your plate be vegetables or fruit. And then therefore you're probably getting pretty close to that 5 to 7 of vegetables that you need per day. So eat more vegetables. All righty. And then here are a couple great studies I just kind of quickly tagged. One of my favorite studies was one with breast cancer. Women that were diagnosed with breast cancer found that consuming 5 or more servings of vegetables and fruits combined with exercise about 30 minutes 6 times a week resulted in a 50% reduction of death from breast cancer, which is pretty remarkable. And then there's been a number of different studies with non-Hodgkin's lymphoma, encouraging lots of fruits and vegetables that had really positive benefits and outcomes. So just encourage those fruits and vegetables. All right, carbohydrates. So I get this question a lot. What can I do? Can I eat carbohydrates? Should I not eat carbohydrates? What should I even be doing here? And there's really 2 different extremes out there. There's one school of thought that says all carbs are bad. You got to stay away from carbs. Don't eat any carbs. It's bad. It's gonna, do all these different things in the body. And then there's the other school of thought that's like, yeah, it doesn't matter. It's not going to have one effect or the other. Don't even worry about it. And really the research and kind of the evidence lies somewhere in between. There are, I would say, better carbs than others. So, carbs that are more, they're called complex carbohydrates. So these are carbohydrates that are lower in the glycemic index. They are higher in fiber. These carbohydrates are good carbohydrates to consume. They would be things like quinoa, amaranth, buckwheat, whole grains, brown rice, amaranth, millet, and beans, legumes. And they are lower in the glycemic index, meaning that they're not going to cause one's blood sugar to spike. And when one's blood sugar spikes really high and very quickly, our cytokines, which are inflammatory molecules, also rise. And we generally want to avoid more cytokine activity or increase inflammation in the body, because that can lead to other things down the road. So we want to encourage some carbohydrates, but we want to encourage the complex carbohydrates and therefore avoid or limit the simple carbohydrates. So simple carbohydrates generally are things like white breads, pastas, candies, cookies, sweet foods, pastries, sugar. And what I tell people, if you're going to go run a marathon, you're going to need that quick, fast glucose spike to help kind of boost your muscles or get you energized. Simple carbohydrates are okay. You can consume some at that point in time to give you that quick energy, and that's what it does. It spikes our blood sugar, and when our blood sugar is elevated like that, it provides a lot of quick fuel to the cells in the body. And so you can then go run, you can go sprint, you can go jump over those hurdles, be an Olympic athlete. But most of us are not doing that for the most part. Maybe you are. And if that is the case, then you can consume a little bit of simple carbohydrates, but most of us aren't. So we need more of a slower, kind of steady glycemic change. And therefore, those complex carbohydrates would be okay to encourage. Alrighty. Potato. I thought that's pretty funny. All right, so here's just a little bit of information specifically in why, a little bit more why we'd want to encourage more of the simple carbohydrates versus, or excuse me, the complex carbohydrates versus the simple carbohydrates. And there.
Dr. Schuster?
Yes.
So we had a couple, we had a couple questions come in. So the first one is side effects post chemo is muscle and joint pains. Is it good to take collagen supplements?
It can be fine. So again, as I mentioned earlier, I with muscle and joint pains, we need to understand that a little bit more, and we need to also check in and see if there are other medications you're on that could be contributing to that, or other health concerns we would want to look into. Yes, I would say for the most part, glucosamine can be a great nutrient at the right dose. It is a seafood derivative. So if you have any shellfish allergies, you'd want to make sure you don't do the glucosamine, chondroitin, and there's other options. There's definitely other options. So if you've tried glucosamine, there may be other things to think about encouraging too. So yeah.
Right. And then there was one other one said, tofu and soy drink save to eat for estrogen plus VEB cancer. Sorry, I don't.
Oh,
it's in the chat box. I don't know if it.
Okay. Yeah. So actually I talked about that, 3 weeks ago about soy. As it relates to breast cancer. And I won't, I think you guys have that talk. You recorded that talk, so maybe they can access that, because I go into soy and different soy products, processed soy versus, and I may talk about it very briefly in a couple moments in this talk. But I'd have her go back into that, because it does go into some of the resources there. I would say, the quick answer to that is moderation, everything in moderation. And you'd want to, so not overdoing the amount of soy in one's diet. So, and then also trying, and so moderation may be maybe a couple days a week, if that, and of having a soy ingredient. And then if you are to eat soy foods, you'd want to use the whole soy. And soy is, since we're talking about protein right now, it can be a good protein source for some individuals, especially someone who maybe is vegan or vegetarian. Soy may be a good protein source, and protein is so important. It is really, really, really important for one's energy, for maintaining muscle mass, for mood. Protein gets broken down into amino acids, which are our building blocks to our neurotransmitters, things like serotonin and dopamine. And so we need to make sure we're getting in enough soy. And that really is going to depend on one's body size, how much they weigh and how much is their activity throughout the day. So protein, did I say soy? Protein? Protein, I'm talking about protein. Soy is a good protein source. And so, protein also is going to help stabilize blood sugar. And my biggest thing, especially one of the big things that I try to implement, is really stabilizing one's blood sugar. So encouraging protein and encouraging healthy fats and fiber are going to help to stabilize blood sugar. So soy may be okay. It does have some phytoestrogenic properties, meaning that, again, it looks like an estrogen potentially in the body, but we're not quite sure. We don't have conclusive evidence to state with affirmation saying that if you eat soy, it's going to mean you're going to get breast cancer. We don't have that information. It doesn't seem to do that. It's not like one equals the other. It's, but there's questions about it because it is a phytoestrogen. It can look like estrogen in the body. So moderation, I would say moderation is key there. Hopefully that kind of answered that question. But again, like I said, I talked a lot about it in the previous talk. So hopefully they can share that presentation with you. So protein, as we mentioned, really, really important. And most women need between 50 and 60 grams of protein per day, broken up throughout the day. Men a little bit higher, maybe 70 to 80, depending on one's activity levels, potentially up to 100 or more. And that can be determined based off of one's weight. Either meeting with a nutritionist or a naturopath can often give you that information, exactly how much protein one may need. Now, if you're not a vegetarian, other protein sources that are great, or if you are a vegetarian, nuts and seeds, complex carbohydrates, cold water fish, so things like salmon, mackerel, anchovies, sardines, and herring, they are all cold water fish, great protein source. And then wild game meat. So if you know anyone who hunts, wild game is a great protein source. They're leaner. They are going to be higher in omega-3s, lower in arachidonic acid, so lower in some of the inflammatory molecules than things like beef. And so encouraging protein, very, very, very important. And fats, as I mentioned, not all fats are created equal, or not all fats are the same. Fats can be very beneficial, especially in reducing inflammation in the body and providing fuel for the body. So I generally encourage patients to do the plant-based fats. So things like avocado and olive oil and nut oils, macadamia nut oil, cashew nut oils. There's all sorts of wonderful oils out there. Limit some of the coconut oils, but coconut can be fine too. Grass-fed butters, great ghee. And there were definitely a number of good studies. I mentioned one here with the Women's Health Initiative, found favorable outcomes when one decreased, when encouraged more of those healthy fats. It led to decreased risks and also incidence of breast cancers, and especially the olive oil. So olive oil is so wonderful. It's so nutrient dense, and it's just a wonderful anti-inflammatory type of oil. So a lot of the principles that I was just talking about today fit into a anti-inflammatory or Mediterranean diet or vegan or vegetarian diet. And even ketogenic diet, there's some deviations with the ketogenic diet. But again, the focus being that we're encouraging primarily plant-based foods, fruits, vegetables, whole grains, nuts and seeds, encouraging more of those plant-based fats like olive oil, using lots of herbs and spices instead of salt to flavor foods, limiting red meats. Red meats can be a little bit more inflammatory in nature, encouraging maybe fish or poultry a couple times a week. And then it's so important to enjoy meals with friends, sitting in a quiet environment, or able to focus on one's meal and chewing your food really well. Digestion and processing of food all starts in the mouth. So just chewing is very, very, very important to one's digestion, to help one's digestion. And, we'll talk about it in a little bit. when can that be consumed and how much, and getting in some movement. So these are the main principles of these types of nutrition models. And let's just move on. All right. Ooh. Okay. So this is just kind of shows what the plate may look like when you're thinking about these type of nutrition models, Mediterranean, vegetarian, vegan, and ketogenic. The difference with ketogenic, and I'll talk about it in a moment, is the ketogenic diet is a very high fat diet and a very low to no carbohydrates, whether those are complex or simple carbohydrates, and kind of a moderate amount of protein. So, and there's a certain time and place when ketogenic diet could be implemented. Whereas the vegetarian, vegan diets, those avoid more of the animal sources of food. So maybe, the meats or even, dairy products or eggs, depending on how strict one may be. So that's how they vary. Oh, skipping ahead. All right. And I just mentioned, ketogenic diet, the primary focus of the ketogenic diet is fats. So lots and lots and lots of fats. And one can do the ketogenic diet in a very sustainable way, but you'd want to be encouraging more of the olive oils, the nut oils, the fish oils, avoiding the bacon and the really high saturated fats, the cheese, moderate amount of proteins, maybe even 50 grams of protein, so a little bit less than what I would say to most individuals they need, and also a very low amount of carbohydrates. All right. And certain situations, this is a good diet for someone to do, but not for everyone. All right, so here's just a quick kind of overview in terms of some of the research. When and what situations for disease prevention would one want to maybe encourage the Mediterranean or the anti-inflammatory diet? So especially in regards to breast cancer, I'm a strong proponent of more of that Mediterranean anti-inflammatory diet. And they found that there was some risk reduction when one did this PriMed study, found that with the Mediterranean diet and extra virgin olive oil, a 68% lower risk of breast cancer. And when you did the Mediterranean diet plus nuts, that was a 40% reduction. So again, really good diets there. They were just looking at olive oil versus nuts, both great healthy fats to think about encouraging. Vegetarian, vegan diets, there are some risk reductions there of total cancer, but no association with all-cause mortality or cancer mortality. And then in regards to the ketogenic diet, there's more studies going on, but again, it's kind of inconsistent with the evidence. There's certain situations or certain certain cancers where it's going to be potentially more beneficial. But they did see, in some animal studies that when someone implemented a more ketogenic diet, it inhibited malignant cell growth. But again, a lot of these studies were mostly done in animals, and not all animals and human physiology are equal. So, the biggest takeaway there with the ketogenic diet is that more studies are needed to really figure out when, and which individual it may be most beneficial to implement. And for how long too, because maybe it's not the most sustainable diet. Alrighty. All right, so I like to show this picture of my clinic director. He's been in practice for a long time. He's still seeing patients, and he loves olive oil. He's from Italian descent, and he puts olive oil on everything, cereal, it's just everything. So he's a big proponent of olive oil. It can do a lot for you. Keep you in practice for many, many, many years. Alrighty. And just some ways to think about meal planning here. Again, like I mentioned earlier, when you are eating, maybe think about, to get in enough fruits and vegetables, think about having half of your plate be and or vegetables. And that picture down there is actually what Nutrition Canada, what Canada recommends. They've all gone away more or less from the food pyramids, and we kind of have these perfect ideal plates. And that's what one may look like. A couple ways to start thinking about encouraging this type of nutrition, like I mentioned, kind of how you design your plate, but also just keeping a diet diary. So you can keep track of what you're eating for a couple days, maybe a week, a couple weeks, and just see how certain foods make you feel. Keep track of your bowel movements, your digestion. Watch out for cravings. I would say, make note of cravings, because that actually can tell me what nutrients your body may need. Especially if you're craving sweets, that may mean you need a little bit more protein or maybe more fat. If you're craving lots of salt, that may mean you need more minerals, so maybe more fruits and vegetables. And medications and other things can kind of influence that too. So keep track of that. And then again, if you're having questions or you're having a hard time figuring out what to eat, or speak with a nutritionist or a naturopathic doctor. All right, so alcohol, real quick here, because I know we're getting close to on time. So what is the biggest takeaway here? Again, moderation. So drinking between 3 to 5 drinks per week has been associated with reduced all-cause mortality. Whereas, if you're drinking 7 to 14 drinks per week, so that's 1 to 2 drinks per night, especially for women, that increases one's risks of developing breast and other cancers. So the less you drink, the better your outcomes may be, or hopefully will be. And so there's some newer research out there too that shows even less is better. So, but the biggest takeaway, moderation or less of alcohol consumption will be better for reducing risks. I'm going to kind of hustle through this next part. So what can one do to strengthen the immune system? First and foremost, I would say is exercise or getting in more movement. So regular exercise does reduce all-cause risk of death, recurrence of cancers, and other common illnesses such as cardiovascular and diabetes. So how much exercise do you need to do? Well, I would say what the American Heart Association or Heart group recommends is between 20 to 30 minutes per day, trying to get an exercise or movement every single day. Now, why? Well, it can help improve one's quality of life. So improve one's energy. As counterintuitive as it may seem, it actually does improve one's energy. It helps to increase some of our endorphins, and as well as other neurotransmitters in the body that help to provide us with some relief in terms of our energy and as well as our mood. It helps to boost our mood. It helps to reduce and minimize our stress response. So it helps to minimize our cortisol levels. It helps to reduce some of our stressors in the body. And it helps to exercise and movements helps with side effects because it helps to increase our detoxification pathways, which we'll talk about in a little bit, and also helps to move medication. So medication doesn't get stuck in certain parts of the body. It kind of keeps things moving. And then maintaining good muscle mass. Exercise will help maintain good muscle mass, and muscle mass is a great indicator of our longevity. So getting in more movement, really important. So what are some tips? How do we start doing this? Like I said, my goal generally is trying to get in 20 to 30 minutes of some type of exercise per day, ideally cardiovascular, or up to 150 minutes per week. That I would say is the bare minimum of exercise. And then if you're having a really hard time finding what you like to do, what kind of exercise you can do, it's great to meet with a physical therapist or consider even joining the YMCA or Livestrong. They offer really great low-cost options for group classes or probably even Zoom classes at this point in time. So just trying to find something you enjoy doing, even that if that's just walking outside for a little bit. Stress and sleep. So I'm not gonna, this part goes into a lot of in regards to how does stress affect our body and how does stress affect our immune system? And there is this big area of ongoing research known as psychoneuroimmunology. And they're doing a lot of research into how stress influences one's cancer outcomes, and understanding the role of stress on the body and mind and spirit during cancer care. And there's a lot of interesting research out there. You can just even Google psychoneuroimmunology, but the takeaway is that, when one is experiencing stress or the body is under stress, one is, our ability to digest our nutrients, to absorb our food, to heal, to, take care of ourselves, to do the many functions that our body needs to do gets hindered because all it's focusing on is trying to run away from this stressor. And so it's secreting tons and tons and tons of hormones, which causes more inflammation in the body. And so we ultimately want to try to help to work on kind of minimizing the stress as much as we can, implementing certain practices like music therapy or meditation or yoga or improving one's sleep to help minimize the release of some of these neurotransmitters or some of these hormones that are stimulating different functions in the body and increasing our stress overall. We want to minimize that. So here are some of the ways to help reduce stress on the body. There's great apps. I would say there's an app for that. There's Headspace, there's Calm, there's Do As One, there's Stop, Breathe, Think. There's a ton of wonderful apps out there. So if you're someone that likes apps, that wants to start implementing kind of a mindfulness-based app or a meditation app, there's great ones out there. There's many free guided meditations that one can listen to, whether that's on YouTube or at this site through the UCLA. And, alternate nostril breathing. So I'm not going to demonstrate it right now, but you can work on, it's a yogic exercise that you basically block one nostril, you breathe in, and then you hold your breath and then breathe out through the other nostril. And then breathe in, hold it, and breathe out. That's alternate nostril breathing. And that helps to relax us. It helps to shift actually even our brain waves and to get us into more of a relaxed state. It's a great yogic exercise. It's something that could be done maybe even before a meditation or a yogic practice. Helps to clear out the sinuses. I actually feel better just even doing that for a brief moment. I'm a little bit congested today. And so it's just a wonderful practice, one of many wonderful practices. Mantras can also be really helpful to help kind of calm the mind, calm the body. There's different ones out there. This is just one example of something that I like to remind myself of or encourage or write a sticky note of and put on my mirror in my bathroom. And ultimately, whenever you're starting to do a stress management technique or work on your stress responses, you want to start practicing during calm. You don't want to start thinking, okay, I can now meditate, or I should meditate while you're in a stressful moment. That is just not the time to start meditation. Be in your most calm state and start practicing there. So maybe that's, first thing in the morning, you're the most calm, and you start practicing with 5 to 10 minutes of a meditation exercise. And then, what's going to happen is that practice then builds and you get better at it over time. And then you're able to do that in the stressful situation. So I think a lot of times people, they tell me I can't meditate or I can't relax. Well, they're trying to do it in very stressful moments when, may not be able to relax or calm down. And that's okay. That's all right. We need, we want to ultimately start implementing and working on the stress and stress reduction techniques in the state of calm that we know are body knows, our nervous system knows how to get back to that during stressful moments. So hopefully that makes sense. If not, let me know. All right, and then sleep. So if we work on one's sleep and improving one's stress, then actually our sleep gets better. So ideally, our sleep goal is 8 to 9 hours of uninterrupted sleep per night. That is the goal. That is when the body is able to work as well as it can. The immune system is able to function as well as it can. So 8 to 9 hours is my goal for patients, and my goal personally as well, to help boost my immune system. So here are a few sleep hygiene techniques, different things to make sure you're doing to help improve your sleep. Make sure your room is cool and dark. I think it's around 68 degrees is kind of the ideal temperature for a good night's sleep, and that allows our body to kind of cool off and get into a deeper state of sleep. Avoid electronics, ideally a couple hours before going into bed, 2-3 hours. Try to turn off your phone or turn off the TV and just kind of unwind. And then unwinding before bed, encouraging natural melatonin production. So how do we encourage more melatonin? Well, we make our room, our environment dark. We turn off our phone's bright lights. And so that our pineal gland, which creates melatonin, is able to secrete the melatonin. It can only create melatonin in a dark room. There are certain foods or certain nutrients that actually can boost our melatonin levels. Things like oatmeal actually does boost a little bit of melatonin. Tart cherry juice can also increase our melatonin levels. Protein also can help kind of with the conversion into melatonin. So, making sure that we're eating well during the day can help us sleep better at night. Doing a warm, not a hot shower or bath before bed also kind of helps to calm us down. And hot is a little bit too stimulating for before bed, but a warm shower or bath can be really quite nice. And then, like I said, nutrition and movement and exercise during the day. And then if you've checked all the boxes there, you're doing all those things and you're still not getting in good, adequate sleep, then it's time to talk about maybe some nutrients or supplements or medications that may be helpful for you. All right. So intermittent fasting or time restricted feeding. So why do we care about this? Why do we even want to do this? Well, what happens in a fasted state is that the body is then able to go in and clear up house. It can do this process known as autophagy, which I wrote down, and it's the body's innate recycling program. So cells know in a fasted state, they go in and they clear up any of the dead cells, any of the cells that are maybe they have a mutation on them, the DNA is not quite right, maybe they have high levels of cholesterol or high levels of glucose in it, and they get rid of it. The body can do that, but it can only happen in a fasted state. And so there is a very large study that was done with women with breast cancer. And they found out that during this study, it was in a study on intermittent fasting, and that when women fasted overnight in accordance with their circadian rhythms for 13 to 16 hours, the lucky number was 13. So 13 hours was all that was needed. It reduced the risks of recurrence with breast cancer. So I tell a lot of my patients to try to implement, if they can, some type of intermittent fasting that's in accordance with one's circadian rhythm. So what does that mean? So if you go to bed or if you eat dinner at 7 o'clock at night, and that's when you finish your meal, then you eat breakfast the next day at 8. That is 13 hours. And that's all time that was needed. Now you could do longer, that would be fine too. And they did see that some inflammatory markers were reduced, the longer one fasted, but really it was the 13 hours that was all that was needed to help with reducing one's breast cancer risk of recurrence. And so that's a great thing that maybe you can start implementing today. Another trick, if you're like, I can't do that long of a fast, that's fine. Try to have dinner be the smallest meal of the day. Just because, you know, our body needs time. It needs time to metabolize our food. And if we eat a large meal, then that food is just going to kind of sit in our belly. And sometimes then even it goes back up into our esophagus and we get symptoms of GERD or reflux if we do not have enough time for our body to digest our dinner, move it through our stomach and into our small intestine. And that takes a couple hours. I like to just remind people that many of our ancestors used to fast. We didn't always have access to foods, and you know that was a form of survival. So our body can do some fasting. Doesn't have to do it all the time, but it can do that and do it well. And it's a great way to help, you know, kind of clean up house. All right. And it's a great way of detoxifying, but there's other ways to help to promote detoxification. And I get this question all the time. How do we detox? And how can I support my body's natural ability to detox? And you can. You want to support all the different pathways of detoxification. So how do we detox in the body? Well, we sweat, we pass bowel movement, we pee. Well, you know, our liver does a whole bunch of stuff. So we want to support our liver. Our immune system also does help with detoxification, specifically the lymphatic system, our lungs, just purely breathing. So, you know, we talked a lot about all of these areas already. So if we're exercising, we're sweating. So that's promoting our skin's ability to detoxify. And actually we get out a lot of heavy metals just through sweat. If we're passing really well-formed bowel movements, we're getting in enough fiber in our diet, and we're able to then pass a really good well-formed bowel movement, well, that's a great way to get out of a lot of toxins. And urination, if we're urinating every day, we're drinking enough water to flush things out of our kidneys, out of our blood system, then that is another wonderful way. So we got to make sure that that system is working well. Liver, if we're, you know, processing our foods and we're processing our hormones well, you know, we often want to support the liver, and there's different ways to do that. Immune system, lymphatic system. Actually, whenever we're moving, we are helping our lymphatic system do its job. And there's other ways to also support the lymphatic system. And then breathing, if we're implementing a mindfulness-based meditation approach, or we're doing the alternate nostril breathing, then that's another wonderful way of detoxifying. We're getting things out of our breath, through our breath, and we're also bringing in more oxygen. So helping our lungs, helping our breath, another great way to detoxify. And then if we are avoiding our, you know, processed foods, we're getting in more whole foods, then we're reducing toxin exposure. So we talked already about that. I like to mention saunas or constitutional hydrotherapy. Those are gentle ways to help promote sweat or help with our immune and lymphatic system. And you doing alternating, you know, maybe you do hot and cold applications. That's another way of doing hydrotherapy or helping to promote or stimulate our immune system and our lymphatic system. And then in certain time and place, you know, nutrients and nutraceuticals can be safe and appropriate to use. But that again is going to be very individualistic, and depending on what organ system, you know, after taking a good comprehensive intake, I can figure out, you know, what nutrient may be needed to help support detoxification. And these are just a few of my favorites. All right. And then lastly, digestion. And we're really, you know, running out of time here. I wish I had more time to go over digestion and the gut microbiome. So I'm just going to be really quick here. This is an area of ongoing research and a passion of mine. It's not, you know, the gut microbiome is a complex community of microorganisms that live in the digestive tract. And the digestive tract spans all the way from our mouth to our anus. And yes, there are trillions of bacteria, viruses, fungi that live in our gut. Some of us help, and some of them help us, and some of them do not. And there's a lot of research going on in terms of what in our microbiome can help our immune system, what doesn't help our immune system, what helps our brain, what helps our skin, what helps our stools. And it's not as simple as just taking a probiotic, unfortunately. Sometimes actually even probiotics they won't help and they actually can hurt. We also need prebiotics. Prebiotics are fiber, and fiber helps to feed some of the good bacteria and sometimes some of the bad bacteria. So there's a time and a place that you really need to work with someone to, work on your gut microbiome and understand how to support your gut and your digestion. So, it really is the core of naturopathic medicine. And my practice and many of the individuals that work at my practice at Northwest Natural Health, we look at one's gastrointestinal tract and at any phase. So whether that's during cancer care or prevention, part of a prevention strategy, or it was something else, just overall well-being, we know what to use, when to use certain things that are safe and effective to help promote the gut and help us, eat our food better, consume our nutrients better, absorb our nutrients better. And a lot of times that's by all the things that we mentioned earlier. We're getting in good nutrients. That's going to help our gut microbiome. We're getting in movement. That's going to also help our gut microbiome. It's going to help improve our peristalsis. We're working on sleep and stress management. Our brain actually influences our gut, and it helps us to digest nutrients. We can only digest our nutrients and process our nutrients in a rested state. So just even implementing more stress management techniques and getting a better night's sleep can help our gut microbiome, and vice versa. Actually, our gut microbiome also does influence our sleep. So everything that I've already talked about in today's lecture and talk, really ultimately, if you start implementing some of those things, will help our gut microbiome and then ultimately help with disease prevention. So yeah, it's pretty cool. Alrighty, so some quick takeaways from today. What are naturopathic doctors' role in your care plan? I have 3 main things we do. We keep you as strong and healthy and comfortable as possible before, during, and after treatment. We work a lot and pay close attention to avoid any unwanted interactions with treatment, and at any point of treatment. And then we try to add in prevention strategies. And some of those things are things I mentioned today in terms of my 6 principles. So finding a sustainable nutrition plan, encouraging movement and exercise, working on sleep and stress management, trying to get in those 8 to 9 hours per day of sleep, and maybe implementing a new 5-minute meditation practice. Intermittent fasting, that might be part of your detoxification and prevention plan. And all that's needed is those 13 hours away from food. Promoting pathways of detoxification, making sure you're getting in good bowel movements, you're breathing, you're moving, you're sweating. So all those things are going to help with detoxification. And if needed, and those pathways are not working as well as we need, we bring in nutrients. And lastly, supporting the gut microbiome. And again, it's just not as simple as adding in a pre or probiotic. They can be helpful, but there's a time and a place for all of those things and all those nutrients. Alrighty, so that was it. We're a bit over time, and I actually do have to run. I can maybe take one more question if there's a question that hasn't been answered, but if there are more questions that I didn't get to, Abra, you can definitely send me an email and I'll answer those questions before the end of the day. And hopefully she can send those out to you guys. I really, really, really appreciate your time and your attention. Hopefully it answered some questions. Hopefully you had a few takeaways from today's talk. And I know that I just want to plug that the next talk is going to be all about sleep, and my colleague Dr. Thapa is going to talk about that. So if you're not getting in those 8 to 9 hours of sleep, or your sleep is really interrupted, or you're just not getting a good quality sleep, you wake up tired and groggy or have a headache, Dr. Thapa will talk about some ways to improve one's sleep. So